Hello, I'm Professor Valarie Blake. I'm a visiting assistant professor at Duquesne Law, and my area of teaching and research is in healthcare law. One of my projects that I'm working on currently is looking at the intersections of the Affordable Care Act and health reform with the impact that changes in financing and delivery will have on patients and particularly their role as consumers of health insurance. So the Affordable Care Act brings about an unprecedented amount of emphasis on healthcare consumerism. Previously, most people were covered by their employers when it came to healthcare insurance, and they often didn't have a lot of choices about the types of policies that they would get. Now, there's going to be a significant increase in the number of people who are going to be required to go onto the market, purchase insurance on their own, and select the different types of policies that are best for themselves and their families. They'll be facing much more complexity of decision and a number of decisions than most people have who, again, result with the default of healthcare that their employers provide them. In that case, we also see an unprecedented amount of federal involvement in how insurance is handled. We see insurance plans being packaged in a more homogeneous way with a certain level of benefits being offered and with less opportunity for them to sort of approach people based on health conditions and rather instead based on mainly their ability to pay and things like that. So my interest in this regard is looking at how exactly these individuals are going to navigate the market. Particularly a reason that I'm interested in that is because of the larger purpose behind health insurance reform and health reform generally. There's a lot of literature discussing the role that health insurance plays in a social sphere and the idea that health insurance has become a larger vehicle for funding care in general and for increasing access to care. In order for that to happen, individuals have to embrace a certain amount of increased cost on themselves in order to cover a larger pool of individuals. We don't yet know how exactly people think about the purchase of health insurance within the context of the Affordable Care Act. There is some research out there in the behavioral economics sphere about how individuals think about purchasing different types of products in general, different types of insurances, how they think about risk. And what we do know is that people tend to not make these decisions very well. They tend to underassess how much risk will happen to them. They tend to rely on rules of thumb that aren't always applicable to themselves but might be to a general audience. They tend to be willing to pay more for things that they can have now as opposed to thinking about long-term economic decisions. So, in short, they don't always act as rational economic actors. That being said, what I'm interested in looking at is how exactly these individuals who are becoming consumers in the health insurance market will think about and make decisions that are best for them individually, and also how exactly, if at all, their decisions will map onto the larger social goals that we're seeking in health insurance and health reform.